In 1998, a group of U.S. doctors and philanthropists working on the border between Thailand and Myanmar started a small non-profit that would become Community Partners International, or CPI. The border offered sanctuary to those fleeing war, poverty, and human rights abuses in Myanmar. Each year, thousands of refugees escaped through the jungles to safety. That was the beginning of CPI's journey with them.
When CPI started, we were working in the middle of active conflict zones. But what we found was that the people we were trying to help had tremendous resilience. Despite landmines being shot at and villages being burned, the people were able to provide basic services such as healthcare for themselves with the proper training and resources.
For the first 10 years, it was a complete backpack approach, and we helped train mobile medics and establish mobile clinics. Everything that they used had to be portable so that they could reach the villagers and travel with them in case that they were displaced. The medics, they risked their lives every day to deliver emergency health services to women and children.
For humanitarian aid to be effective, the communities themselves have to be in charge. They have the local knowledge, they know the terrain, and most importantly, they have the trust of the people.
The medics, they developed incredible skills. They carried out amputations and other types of emergency surgery safely on the jungle floor. They provided care to pregnant women and young children. They treated deadly diseases like malaria. They saved so many lives.
As Myanmar has plunged back into turmoil following the February 2021 coup, CPI is helping vulnerable communities to meet their urgent health and humanitarian needs.
We have adapted our approach to help communities, not just to provide services, but also to strengthen their health systems so that every person, especially the most vulnerable, can access essential health services.
Myanmar's descent into civil war and the country's vulnerability to climate change mean that communities face many emergencies. CPI and its local partners are able to reach the regions hardest hit by conflict, natural disasters, and poverty. CPI supports communities across Myanmar, from urban poor populations in Yangon to ethnic peoples in Kayin, Kaya, Shan, and Kachin states.
As COVID-19 cases rise, we are training health workers to spread the word about the physical distancing, hygiene, and other preventive measures. This is especially important for conflict-affected communities without internet connection.
In 2017, when violence in Myanmar's Rakhine State forced nearly 1 million Rohingya to seek shelter as refugees in Bangladesh, Community Partners International mobilized. CPI trained a network of Rohingya community volunteers to deliver essential services in the world's largest refugee camp.
Building community capacity in this way helps to strengthen Rohingya self-sufficiency and resilience. The camps are actually a perfect environment for COVID-19 to spread. Our volunteers are educating fellow refugees on how to stay safe, distributing hygiene supplies, and also helping with home-based care, hospital referrals, and contact tracing as well. Our volunteers have also installed 150 hand washing stations in and around the camp area. We have set up and are now operating a COVID-19 isolation and treatment facility at the district hospital in Cox's Bazar.
With your help, CPI can continue our partnerships with local communities to achieve life-changing impacts.
What was true 20 years ago when we started CPI remains true today. As an ER doctor fighting the COVID-19 pandemic in the United States, counting ventilators and hospital beds, I can honestly say that the hundreds of thousands of people that we serve in Myanmar and Bangladesh have once again demonstrated their incredible capacity to provide services for themselves.